Hello, I'm Roger Neighbour, and welcome to Scotland. I wish you could be here with me in the beautiful Scottish Highlands. Actually, I wish I was there too, because actually I'm in my study at home. The magic of technology enables us to create an illusion, a fantasy, a false vision of reality. And that's what I want to talk to you about today, about what's real and what's not real in the general practice of the future. I'm going to go to screen share now. The coronavirus has had a tremendous impact on all our lives, but as science brings the pandemic under control and we begin to return to something like normal life, this is an important time to be a doctor. It's a really important time to be a general practitioner. It's a really, really important time to be a young general practitioner, because you hold the future of general practice in your hands. Here's what I want to say today. The COVID-19 pandemic has accelerated changes in general practice that were already underway, including important changes in how we consult and in what we think about the doctor-patient relationship. And quite a lot of these changes have consequences for how we're going to care for our patients in the future. And so I want to ask us what aspects of care after the pandemic are real and precious, and which, if any, are dangerous illusions. So let's start with what is it that's accelerated these changes, and what are the changes? I think you'll all agree with me that medicine has got much more complex and costly in recent years, and also patients' expectations have increased all the time in a spirit of consumerism. Our politicians too, of course, need us to practice medicine in a way that's cost efficient. And I don't know about where you're working, but certainly here in the United Kingdom, we have a real shortage of time, of resources, and of doctors. Doctors, of course, have lives of their own. We need a decent work-life balance too. But the big change, of course, has been the advance in information technology. And the effects of that has been to increase the amount of work that we do that is done by algorithms and guidelines and protocols, making use of machine intelligence and decision-making software. We're now working at scale, which means bigger groups of doctors working in ever larger organizations in order to achieve economies of scale. And we're making greater use than ever before of colleagues such as physician assistants and nurse practitioners. And it has to be acknowledged that these changes have reduced the degree of continuity of care that our patients enjoy. And that, of course, has had some knock-on effects on how we consult and on the doctor-patient relationship. We're using information technology much more for communication, to manage information and knowledge, and to aid our decision-making. And in particular, during the pandemic, more and more of our work has been done remotely by telephone or video consulting. And that has necessitated more triage, more assessment of the patient before the consultation to see what the problem is. And that has been done either by algorithms, perhaps on a computer, or by some kind of structured conversation with a non-clinical person, such as a receptionist. I think we have to admit too, don't we, that consulting, particularly rapport, is more difficult over the phone or even by video. It's much more difficult. And some, if not many, of the subtleties of face-to-face consulting can get lost. And as a result, I think our style of consulting with patients has inevitably become less patient-centered and more doctor-centered. And so some of these changes have consequences for how we're going to care for our patients in the future, particularly the technology-based advances. Certainly for some patients, possibly many patients, the possibility of remote consulting has brought to them a greater degree of choice about how they can consult. And with that, perhaps it can be more convenient for some patients. It's certainly more convenient for many doctors to consult remotely without having to have fixed times for surgeries and spend a lot of time traveling. And for some patients too, if transport is difficult or they're housebound, it can be more convenient. And it certainly makes more efficient use of doctors' time for a greater proportion of the working day to be conducted on the phone or by a video link. But there are some downsides, we have to accept that. For the doctor, long periods of remote consulting by phone can feel a bit like working in a call center. And for the patients too, the experience can be a bit like ordering goods from Amazon, like online shopping. And there is the possibility, I think you'll agree, that general practice could, if we're not careful, end up just dealing with minor illness or chronic illness, or triaging patients' complaints to sort out the serious from the not so serious, and just arranging referrals. And that would be pretty soul destroying. That would reduce our clinical skills, and it would certainly lower the job satisfaction that I think is what many doctors enjoy. And I don't know whether, or to what extent, the personal doctor-patient relationship could survive in those conditions. It would certainly alter. Because if general practice just became a call center business, never seeing patients or seldom seeing patients face to face, wouldn't that be soul destroying, dull, tedious? Who'd want to do that job? You'd find experienced doctors leaving out of sheer frustration and boredom, and we'd find it very hard to recruit younger doctors early in their careers, to recruit them into general practice. Where would the satisfaction be? And not least, if we go too far down the technology route, there is the danger of widening health inequalities between, on the one hand, the well-off, the articulate, the tech-savvy, the bright people on the one hand, and the poorer people, less articulate, less familiar with technology on the other hand. And of course, this second disadvantaged group are the ones who need us most. So going too far down the technology route could widen health inequalities in a way that I personally would regret. So if we just have a think about what are the what aspects of these possible futures are precious and important and real and to be preserved, and which are perhaps illusory, perhaps a little more dangerous. Because here's the nightmare vision of what general practice could be. Here's the nightmare vision. We could end up practicing call center medicine. GPs could just become clones of each other, all obeying the protocols and doing what they're told and following the guidelines in an impersonal way. That would feel like being on a treadmill, no fun at all. And I think it would gradually reduce the care that we can feel for our patients. We would find ourselves turning our back on individual cases and just following the rules slavishly. That would be the nightmare vision. But it doesn't have to be like that, of course. If we use technology wisely and skillfully, it could be so much better. Skilled use of technology, as COVID is teaching us, can improve our efficiency. It can boost our teamwork. It can offer patients much more genuine choice, provided the choice is genuine and they are free to choose face-to-face or remote consulting as they please. It can be much more convenient for everybody. And certainly the skilled use of diagnostic software and decision-making aids can improve our clinical competence. Put all those things together, wisely used technology could enhance our personal care no end. think it all depends on what we mean by care. Can be a tendency to think of care as a commodity, something that's produced, manufactured, packaged on a factory line, distributed in boxes and sent out to patients, like a packet of biscuits or a delivery from Amazon. But care isn't a commodity. Care is what you do for another person. Care is something that you give to another person. During COVID, we've developed many new ways of working. And whether these new ways of working become our masters or our servants depends on you. It depends on whether the care you give your patients is an illusion or reality, a fantasy or something solid, rooted in personal care and rooted in personal relationships. Please choose wisely. I wish all of you very happy careers in general practice, and thank you for listening. Bye-bye.